Welcome. I am Grace Kistner. I have been clinically trained as an ICU nurse. I did that for 10 years, and this year I have transitioned into supporting some research in academia. I'm currently based in the San Francisco Bay Area, and I co-facilitate this cafe with Michael Palachek. He's not going to be able to join us today, but this is the Nurse Policy Cafe, Nurse Policy Entrepreneur Cafe, where we come together to address how to approach policy issues, not the issues themselves, but how nurses can be empowered to identify as nurse policy entrepreneurs and to have a safe space in the sense that you come as you are from wherever you are for some group mentorship in helping find the development and resources for that. So welcome. So at this point, I'm so happy to welcome Vanessa Forsythe. I am on the Leadership Council of the California Nurses for Environmental Health and Justice with her. She is a registered nurse and a master's prepared nurse and a retired school nurse. She is also a co-chair of the policy committee for the California Nurses for Environmental Health and Justice, and she's passionate about pesticide reform and a just transition from fossil fuels to electrification for improved air quality. She's also a member of the Sierra Club, Climate Health Now, Clean Earth for Kids, and Vote for Climate and Health. Her longtime political advocacy for healthy policies exemplifies how nurses can civically engage to improve their communities. And I know that she has been very active because when I looked up the website called Legiscan here in California to see how many times she has participated in giving testimony or public comment, her name came up 68 times for the California legislature. So she has been very active. Vanessa, I welcome
That's just
you.
this year, right, Grace?
Just this year. I welcome you to start presenting. Thank you so much for being here, and please share anything else about yourself that I've missed.
Okay, not too much else to share. I've been a nurse for like 40 years, and I have had lots of different experiences. And most recently, before I retired, I was a school nurse. And that's kind of how I got into policy and advocacy based on the community of students and parents in schools. And during COVID, I joined some organizations where the focus was on healthcare and policy and advocacy and environmental justice. So in seeing all of who you are, I hope that this is relevant. I'm kind of more a grassroots person. Although science is always what we have to go to in terms of supporting facts, but I'm going to just give you an overview of some things that have impacted that are significant to me in terms of advocacy and how civic engagement intersects with health policy. So Grace is going to share slides. So to start, as healthcare providers, we want to do what's best for the populations that we serve. But we need to realize that what is medical care only accounts for 10 to 20% of what's going to make a difference in terms of health outcomes. What is significant, and you can see here, somewhat genetics. I think we've overemphasized genetics in healthcare policy, and sometimes to the point of using it as a discriminatory aspect of healthcare. But what we have now in looking at these social determinants of health, that there are health-related behaviors, socioeconomic and environmental factors that really are the most impactful in terms of health outcomes, like 70 to 80%. When we consider things like, income has a lot to do in terms of many aspects of health, accessibility, and other factors related to, you know, how your social support. That's something that I think we also, that sometimes we overlook the significance of social support in terms of our patients. Um, Food, what we eat, certain behavior things like smoking, drinking, exercise, you know, we're all familiar with these as impacting health outcomes. Things like clean air, housing, safety. And safety is, again, a big issue as we're dealing with climate change, I believe, impacting a lot mental health. Housing, you know, we deal with populations that are unhoused or don't have secure housing. And then with, again, climate change, clean air. So if you can advance the slide for me. Okay, so the social determinants of health are, you know, defined as those things in the environment where we are born, live, learn, work, worship, and age that affect a range of health functioning and our quality of life health outcomes. The thing to realize in terms of social determinants, I believe that's significant, is there was something that preceded these factors, and that they have a lot to do with policy decisions that were made that actually um, resulted in these social determinants of health. So if we talk about things like you know, redlining. I think you're all familiar with that term, uh, where certain people uh, were said, "This is where you're going to live, and this is where we're going to put industry in places where people have, you know, live in environments that don't have clean air, um, as opposed to, say, you know, where I live as an entitled person, you know, I am near the ocean. The air quality is, we are being impacted by the air quality in terms of wildfires here in California. But, you know, I have more choices, and there were certainly policy decisions in terms of, you know, the building of housing and who lives here. Um, it's not very diverse. You know, those all were impacted by policy decisions, whether it was at the local, state, or federal government level. So go ahead, Grace. And I guess I should ask if you want to, um, you know, have a question or interject something, I'm okay with that. And maybe you can, you know, raise your hand, or Grace, you know, if there's something going on in the chat. So the other thing in terms of health policy that I think we can be impactful, and I think some of you already so much are, is civic engagement. And civic engagement, again, is just a term that, or a construct that says, you know, how you get involved as an individual or a group within your community or life, public life, even your place where you work or go to school, to address issues of public concern that you are then looking to improve community conditions. So Grace kind of came up with this little side thing here. You know, it's all about so many things. It's about social justice. It's about racial equity. It's about, you know, women's rights, E- LGBTQ rights, immigrant rights, and criminal justice reform. But there's certain things that, you know, whatever your passion is, you know, you can be engaged as a citizen or a non-citizen in advocacy, I believe, and that you can make a difference in your community. And then there's things that we can do, you know, in terms of building coalitions, organizing at the grassroots level, which is what I believe I do a lot. And also, a big thing is mobilize, right? Taking action. At the end of my signature, I refer to marching, that we have to sometimes actually march. So that's a big thing that, for me personally, that's really important. So go ahead, Grace. And then there's healthcare policy. So policy is basically, some decision makers set out some rules, right? Um, and that they're looking to achieve some goals, like legislation. That can be policy, and a lot of legislation does impact healthcare policy, particularly in the area of our practice. And when I was younger, I focused more on, practice issues. But then I said, well, healthcare, I can only be so impactful in terms of my practice. It's so much more, and I need to impact policy. So, it's how we look at protecting people. Um, it's how we, as a society, right, improve care. And with improving care, there's factors like quality, accessibility, how we respond to the needs of people who have care needs, strengthening healthcare systems, and improving prevention. So, again, I was kind of looking at this as, healthcare policy happens where we are working and practicing. And sometimes as nurses, we don't realize how we can influence our work settings in terms of uh, policy. So, but I'm retired, so I'm going to leave that somewhat up to you. Um, but yeah, go ahead, Grace. So this model or a framework, I hope you can see it, is actually from the Ontario Health Care System Social Determinants of Health. And they were looking at shifting from, what's the matter with you as a patient to what matters to you as a patient. And I think as nurses, because of our ability at the bedside or wherever, we do an overall assessment of the whole person, um, not just focusing on, you know, a condition or an illness. So this approach of, you have to consider all these things when looking at healthcare, I believe. The center is social determinants of health, where the person lives and what environmental factors affect them. But when you're looking at trying to bring change, you have this whole thing. And I kind of started with listen to what matters. So first, finding out what the issue is in terms of people who are the stakeholders as well as people who are being impacted. It's collecting the right data. And, we have a lot of science to support um, what is happening in terms of just climate change and how that is impacting people where they live. So, um, harnessing collective action, sometimes we don't realize who is in our sphere of influence. And so it's kind of reaching out and connecting to like-minded people in terms of their values and concerns. Mobilizing knowledge is, presenting your facts and figuring out how you can best take action. For a lot of situations, it's funding barriers, but sometimes, like here in California, we have a big deficit. So the state, so that's impacting a lot of what we're waiting to see what the governor is going to sign in terms of bills, because he has the out of saying, we can't afford this. but sometimes you can present it in an alternative way. And lots of times what I will, and other people that I'm working with, but if we don't do this, what is it actually costing us, right? So sometimes that's another approach to addressing funding barriers. Um, and then, you kind of need to come together on a system approach that's going to work. And yeah, I have found that we can shift power dynamics. Sometimes it's bringing in people who um, might not be with us all the way, but they're with us in some ways. And also, it's using our numbers to influence change. And, you know, I believe, lots of times what has been the focus in terms of healthcare, again, needs to be shifted more towards, the population that we serve and what matters to them. So go ahead. And I'm just going to share a couple of uh, efforts or experiences that I had in terms of trying to impact policy. And, very much from the perspective of myself as a nurse. And one thing is legislation here in California. We have legislative sessions that go for 2 years. So a lot of what my perspective is that you just have to persevere and keep driving your points home and not feel like anything is one and done. So California AB 2316 was brought up by Gabriel, Assembly Member Gabriel. And, what happens with a bill is, one of the legislative people will sponsor it and work with uh, collaboratively with other organizations who have an interest in it. And sometimes, again, anybody can bring up a bill and for any issue, but you have to have someone within the one of the legislators rather, um, bring it up and sponsor it. And this particular bill has to do with synthetic food dyes that are added to give like color and things like, you know, um, candy, right? Cereal, but so many different things. And what we had science backing us on is that these specific food dyes um, are have been shown to have impact on um, neurologically on students and children um, in terms of more likely to have ADHD and behavior problems or issues, right? So the thing is, you kind of follow a bill from the start. It gets introduced in one of the houses, either the Senate or the Assembly. It has to go through committees and hearings. And actually, uh, I worked with a coalition with the Environmental Work Group, um, and they connected us with legislators along the process. In terms of legislation here in California, it's a lot working with the legislative aides who, are usually very young people, but very knowledgeable. And you're looking to get them on your side. And I would just want to share for this bill, which now has passed both the House and the Senate and is waiting for the governor to sign or not. He has until the end of September, I believe. Um, Governor Newsom, you've probably heard of him in the news. Um, but we met with legislative aides who were not buying in initially to support this bill when the votes were coming up. And what was impactful is a group of us nurses, and they had groups of scientists, they had dietitians, they had this was all organized, but we were the nursing group speaking. And one of the nurses, um, she's actually a professor at Stanislaus. Um, she shared that she had to go to the grocery store and look at reading all the labels when her son was younger because he had attention deficit and his behavior was impacted somewhat, she believed, by what he ate. And she could spend the time and the money to get food that didn't have these synthetic food dyes that, were impacting his health. And yet the reality is that she couldn't influence what he ate at school. So this bill specifically is about what the kids are served at school. And also, she was in a position to have, the time and the money to make different choices for her child, like send him with school food to eat at school that she prepared. But not all of the parents have that, and they don't know always what their kids being served at food or can provide them alternatives. So it was also an equity issue. So in terms of how the legislative aides responded when we presented these concerns, I think what she shared in terms of her personal story was very impactful. So yeah, we a lot of my advocacy is around children as well as pesticides because we are all being impacted by pesticides and we don't know where our food comes from. So that's another big concern. But yeah, this is something that we worked on for actually 2 years, and we didn't get everything we wanted. But because amendments happen and there's a lot of pushback by industry. But these food dyes are banned in lots of other countries. We have from the EPA and also from the WIHA studies that supported the science of these are harmful for the neurodevelopment of children. Okay, you can go ahead, Grace. Am I doing okay for time? I don't want to.
Yeah,
Okay,
absolutely.
okay. So another thing is, you know, I also work locally. I live in San Diego County in this community of Carlsbad. A lot of things that impact our lives in terms of health policy actually happen at the local and county level, and we can engage at any time. But it is a time factor, I'll give you that. But there's different ways that you can impact health policy decisions even at the local level. So here in Carlsbad, some people don't think this is good, but we actually passed an ordinance that bans smoking and vaping in apartment and condo buildings. So here in California, people are not allowed to smoke in certain public places, like, restaurants. In Encinitas, you can't smoke outdoors within any certain distance of public places. And I was involved in giving testimony there too. But this one specifically addresses, you know, people who live in shared housing. So we were concerned about the impact, particularly for young people and people with respiratory conditions, vulnerable populations who were being impacted by smoke that came through literally the walls that they shared with other um, apartment dwellers or whatever. Um, the smoke can actually go through the outlets and the vents, and remains in the carpet, remains in upholstery, and uh, so all smoke is harmful, whether it be any kind of smoke. But I was approached by Vista Community Clinic, who was working on a grant um, to bring about this effort. We worked again over a matter of a year and a half trying to get this ordinance passed. I At every city council meeting, there is agenda items that you can see what's going to be discussed, but there's also a period where you can just speak about anything at the beginning. They limit how long you can talk, but you can get up to the podium and say, as a concerned citizen, this is something that I see happening in my community and I want you to address, right? So I focused on the health concerns and what I saw as a school nurse in terms of the impact of students who had asthma and exacerbations that happened when they were living in areas where there was more people smoking in their environment. And so, this took some time. Um, I had met individually with some of the city council members to kind of educate them as to this concern. And I also got other people to write to city council members. When I think this is similar in other communities, you can send an email to the city clerk and ask for it to be part of the public. It will be part of the public record. And again, if you don't have time to go to a meeting, you can share your concern this way to your city council members, and we have a mayor too. Um, and The thing that I saw very impactful in this effort was that we had youth come and speak directly when at the city council meetings regarding this ordinance. It is also important. So when you go to city council meetings, they don't always look up, or any public meeting. They're sometimes not engaged, but when the youth speak, I notice that they are more engaged and listen. Another way is to impact policy and to get something to happen in terms of at your local level is, writing letters to the editor. Um, it's also knowing who covers, uh, who in the media covers your area, and asking them to come and show at meetings so that there again is public record of what's happening. And the media is a good way to get things out. Um, so yeah, we did get this to happen. And what was, again, to know what the other side, what the opponents feel. A big issue was that they didn't want to use police time to enforce this, but we focused more on it being part of like rental agreements, and that enforcing it by, if a tenant or was not abiding by what they agreed in a contract, that the property owners could take action. So again, that was more on the local level. Go ahead, Grace. Um, so Daniel Dawes is someone who's written this Political Determinants of Health, and I haven't read the whole book, but I read some of his what he's written. And, the political determinants of health, again, is a process of structuring relationships, distributing resources, administering power, and operating simultaneously in ways that reinforce or influence one another to shape opportunities that either advance health equity or they can also exacerbate health inequities. And I think we are seeing a lot of that in terms of here in the United States and of course globally, but the issue of health inequities where decision makers are limiting access to care because even nonprofit institutions look at making money, and our healthcare policy doesn't benefit all equally. It at state levels, we see a lot of discrepancies as to, just what one procedure costs where you might live here versus where you live in a more rural area, or even being able to access that. So I think in the media does some good and some bad in terms of presenting what are issues related to accessing healthcare. Um, but our healthcare, I think, is very, in a sense, fragmented. This is my opinion, and we have to always be advocating for better healthcare policy. So, go ahead, Grace. And I have been in healthcare for a while, and I didn't really realize, but over time, just how much inequality and injustice there is in health. And, um, this has been recognized for some time, but we aren't really making progress enough in the right direction to address this. I mean, there are so many populations that not only are vulnerable, but underserved. And, we don't always realize our own biases, but we all have biases. And in nursing, I think only, less than 20% of the nurses come from diverse populations, represent different ethnic groups. And I think that is very, negative. And because if you don't come from some place, you don't always know what's really happening in that place. Or if you're not part of that community, you can't best understand what needs to happen for that community in terms of health policy. So go ahead, Grace. So for me, the big thing that I look to do is, and I think Grace can attest to this, she's known me long enough, is based on relationships, building relationships. And, you know, sometimes I've been in the position of not having the authority maybe to make decisions, but actually we're making decisions at the bedside all the time, and we're doing those assessments. And I think we're the best to also understand within our institutions as well as where we live what are the needs for healthcare policy change. And I wanted to present here that, it isn't so difficult to be engaged in a civic way. That's kind of, what I'm all about. But, at whatever level, you can impact policy, you can be engaged in civically. So sometimes, it is through a shift in power dynamics that we can work to elevate and bring together and then elevate community partners who are in a position to lead based on their knowledge and having trusted relationships. I mean, I am again about using my connections. I know from working in the school district, school board members who I said, hey, you have influence over this legislator. Will you please contact them and tell them why, this is so important to have this uh, bill passed for kids? And, that um, trust and cooperation is something that's built over time and experience, shared experience. So go ahead, Grace. I wanted to just share this. We are now you know, coming to an election here in the United States. Um, and another group that I worked with, we wanted to emphasize the importance of voting as basically a social determinant of health. It's called Vote for Climate Health, and it was made up of we are nurses and uh, physicians in different roles who said, we have, I think it's kind of mind-boggling, but I don't want to quote it because I don't have it in front of me, but a significant number of healthcare providers don't vote. And here in California, this is not true in all states. We get mail ballots, and all we have to do is check the boxes in terms of who we are voting for and what ballot measures, which can be kind of confusing themselves, but um, fill that out, sign it, and put it back in the mail without a stamp. That's our vote. I mean, there's other ways to vote, but it's very easy here. So the California Medical Association and uh, I forget her last name, but one of the physicians who was brought this forward to recognize voting as a social determinant of health. And through this council's recommendation, they adopted a resolution to establish climate change, civic engagement, and voting as all related and circular and important to every um, person's health. So, yeah, so I guess my message is go out and vote. Wherever possible. Sometimes it's very difficult and you need to have a plan. We're saying, you know, how you're going to get to a polling booth, when you need to be there by, that type of thing. So yeah, go ahead, Grace. And then the other thing that I just want to close with is, find and know your community. Those are the people who are where you live, um, who you've had shared experiences, who have similar values. Build relationships with them. Um, know first by listening what are their concerns, and when you do civic engagement, when you do advocacy work, what's most impactful, I found, is sharing your story. So, it it's it matters because it humanizes it or whatever. But facts are important, but they are not always how we determine um, actions. It's more about our past experiences, and sharing your story is impactful. So thank you. Do you have anything that you as individuals would feel comfortable sharing in this realm? I mean, I kind of went pretty downstream. I mean, it sounds like a lot of you are more upstream in terms of your backgrounds. But I think wherever we're at, we can impact health policy.
Thank you so much, Vanessa. That was really great. I love how your slides tie together so well that every social determinant of health is impacted by policy, that every policy is impacted through civic engagement, and that civic engagement impact our health through policy in all of the social determinants of health. So as you mentioned, whether you're looking upstream or downstream, we kind of need to address things from both perspectives, right? And also that you said nurses know what the matter is with your health, with your anatomy and physiology. That's the science of our practice. But we also know what's the matter with all, or what matters about what's the matter in all of these social determinants of health. We're well poised to address all of these issues with a holistic perspective, but also poised to translate this to other disciplines, other sectors. And we have to work together, be persistent, get creative, and find those shared solutions, find those shared values to be able to make those impactful changes. But I think why I thought it was so important that you shared this in this particular group is that nurses don't always know how to plug in and take that action. But even every small action, no matter how small it is, it could just be mailing in your ballot, or it could just be sharing your story. They can have really big impact. And I don't think that nurses realize, certainly haven't realized what my education and my practice, my lived experience as a nurse has gotten me so much information and insight that without having done this, being a member of the general public, I would not realize and be able to connect all these dots. And that is part of what I see our job is, our imperative is as nurses. And so that's how I really appreciate how you shared that and the way we can do it with civic engagement.